Welcome to Al-harmain Institute of Health Sciences. Today I want to discuss about the gynecological MCQs. First, the primary hormone responsible for uterine contractions during labor is what? And the best option is C, oxytocin. The oxytocin is a perfect option. Okay, question number 2. The term for the first milk produced after delivery is what? There are four options, but the best option is A, colostrum. Colostrum is the first milk produced after delivery. Okay, now we would move towards question number 3. A normal fetal heart rate ranges from what? As you can see that there are four options and the best option is B, 120 to 160 beat per minute. Okay, next question number 4. The first stage of labor includes what? A, delivery of placenta. B, effacement and dilation of the cervix. So, B is the perfect answer. The first stage include effacement and dilation of the cervix, 0 to 10 centimeter. Okay, next, the most common position for a woman during labor, as you student must be known about this. The position is C, lithotomy position, and the lithotomy position is a perfect position during labor or the birth for child. Okay, next, an Apgar score of 7 to 10 indicates what? A, severe distress, moderate distress, no distress, or immediate resuscitation. So, the option C is the perfect no distress. Okay, now question number 7. Which of the following is a sign of placental abruption? A, bright and vaginal bleeding. B, painful contraction, increased fetal movement, or both A and B. And the best option is D, bright red vaginal bleeding and painful contraction. Both A and B is the correct option. Okay, next, the ideal time for the cord clamping is what? Immediately after birth, within 30 seconds, after pulsation stops, and 5 minutes after birth. So, the best option is C, after pulsation stops. Okay, number 9, breastfeeding should ideally begins what? Within the first hour after birth, after 24 hours, only after the milk comes, and at 3 days postpartum. Oh, okay, within the first 10 hour after birth, it should be breastfed. The term for the period immediately after childbirth is called what? Prenatal, perinatal, postpartum, or antenatal. So the best option is C, postpartum. After delivery is a postpartum period. Okay, so a woman's due date is typically calculated by what? How to calculate a woman's due date? So the best option is both A and B, adding 9 months the last menstrual cycle and subtract it. Okay, next, which of the following position may help to relieve back pain during labor? What? A, lying flat on the back, sitting upright, leaning forward on birthing ball, or standing still. So, leaning forward on a birthing ball, so it's the best option, C. Next, the purpose of the fundal height measurement is to what? A, assess fetal position, determine gestational age, evaluate placental health, and monitor maternal weight. So the best option is B, determine gestational age. Okay, the appropriate weight gain during pregnancy for a woman with a normal BMI is what? 15 to 25 pound, 25 to 35 pound, 35 to 45, 10 to 20 pound. And so the best option is the approximately pound 25 to 35 pound. Okay, a sign of preterm labor is what? A, regular contractions before 37 weeks, fetal movement, C, edema of the feet, and D, weight gain. So the best option is A, regular contractions before 37 weeks is a preterm labor. Okay, next, in which stage of labor does the baby crown? In first stage, second stage, third stage, or a fourth stage? So the best option is, and the crowning will be held in which stage? Second stage, because the birth of the head is coming out. Now, next, the correct position for the fetus in a vaginal delivery is A, breech, B, transverse, cephalic, or oblique. So, the best position, correct position is, the best option is cephalic, C. Okay, a woman in labor is said to be in latent phase when she is 0 to 3 centimeter, 4 to 7 centimeter, 8 to 10 centimeter, and in active labor. So, the best option is A, 0 to 3 centimeter dilated is a latent phase. Next, move toward 19. The best way to monitor fetal heart rate during labor is through what? Ultrasound, Doppler, external fetal monitor, or internal fetal monitor. So, the best option for the best answer is option C, external fetal monitor. Okay, next 20. The normal range for the postpartum blood loss after a vaginal delivery is 100 to 50 ml, 500 ml, 500 to 1000, 50 to 150, and 150 to 300 ml. So, the best option is the